State health officials are now monitoring 3 measles cases in southeast Michigan.
The first case was reported in Oakland County. The second and third cases popped up over the weekend in Wayne and Washtenaw counties. Right now, the CDC says that there are 41 cases of the measles across 16 states. For comparison, there were a total of 49 cases in 2021, 121 in 2022, and 58 last year. Joining us now is Dr. Natasha Bagdasarian, Chief Medical Executive for the state of Michigan. Thank you for being here with us.
Thank you for having me on.
Big cause for concern that these numbers are so high already. What do you think that the public needs to take away from that?
Well, a couple of things. We're seeing a rise in measles cases, both globally as well as more outbreaks in the United States, and that's in the setting of low vaccination rates. So we really want to encourage people to get vaccinated as soon as possible.
Now, we saw a press release from the Washtenaw County Medical Department saying most people who are exposed potentially are likely to come down with measles if they are not vaccinated. Can you talk about just how contagious measles is?
So measles is one of the most transmissible diseases that we have. When we talk about disease transmission, it really it sets itself apart from other viruses. It can remain airborne in microscopic particles for up to 2 hours. And in fact, you don't even have to be in the same room as someone with measles to contract measles, just because it is so heavily transmissible. And so we are really advising people that, number one, this is something that is entirely preventable. The efficacy of 2 doses of the measles vaccine is about 97 to 98% effective in preventing disease. And so because of how transmissible it is, and really anyone who is unvaccinated is at risk, we're really encouraging people to take those steps tonight.
So in addition to vaccination status, what sorts of things do people need to be mindful of?
Well, the 3 cases that we've had in Michigan thus far have all been imported cases, meaning these are in folks who have traveled overseas. So if you are traveling overseas, it's really a good idea to make sure that you're up to date with all your vaccines. However, even if you don't have plans to travel, if you have a family member who's unvaccinated, or if you have folks in your family or in your community who are too young to get vaccinated, for example, it's a good idea to make sure that everyone who is eligible has received that measles vaccination. The other point that's really important to remember is that if you think that you may have been exposed to measles, or if you have symptoms that are concerning for measles, call ahead before you go to your doctor's office or to an urgent care or emergency department, because if you don't call ahead, they may not take steps to prevent exposure, and we want to avoid as many exposures as we can.
Now, most people, most adults in particular, are going to have been vaccinated. Can you talk about how to verify whether you have or not? We know there's a website you can go to, but then also for those who maybe have moved around a little bit and they're not sure where those medical records are.
So you can call your healthcare provider. Your healthcare provider should be able to access your Michigan immunization records. Now, if you lived out of state, you may need to call your previous providers or call your local health department, either from the area where you reside now or from a previous area, to look up those vaccination records.
Now, again, with the numbers jumping pretty quickly, a big cause for concern. Is this something that people need to be doing immediately, or is this something you can take your time on? Or do you think acting fast is the best way to go?
Acting fast is really the best approach here. Now, I don't want to raise alarm. I don't want people to become overly concerned about this, because there have only been 3 cases thus far. But what this means is that there are more cases coming into our state and more opportunities for people to become exposed. So if you haven't been vaccinated, this is a really good time to have your medical records checked and to see if you're due for a dose of that measles vaccine. And again, the sooner you act, the better. Measles vaccine is in fact even helpful if you have had a recent exposure. So if your exposure was within the last 72 hours, that measles vaccine can still be helpful. So it really is something where we want people to act sooner rather than later.
Sure. Dr. Natasha Bagdasarian, Chief Medical Executive for the state of Michigan, thanks so much for your time today.
Thanks for having me on.